I'm Dr. John Gelles from the Cornea and Laser Eye Institute. I'm going to go ahead and tell you a little bit about the Ovitz Ayers lens and our experience in the clinic here. I work at the CLEI Center for Keratoconus in Teaneck, New Jersey, a subdivision of the Cornea and Laser Eye Institute with Dr. Peter Hirsch and Dr. Stephen Greenstein. So our first case with the Ovitz lens was a 67-year-old male with keratoconus. They had a retinal artery occlusion in the left eye, so we're unable to achieve vision in that eye. On their right eye, they had worn a scleral contact lens before and had complaints of poor vision with streaking and halos at nighttime. Their vision was 20/40 plus, and there was no improvement that could be had by just tweaking the optics of the lens. What we did was we measured the current scleral lens on an aberrometer, and an aberrometer basically measures the amount of light scatter that's present. As you can see here, there's three different representations of the scans here measuring out the higher order aberrations present. And you can see those in the bar graphs as well as the maps. The maps show some irregularity to them. The bar graphs are elevated. So this was with the traditional scleral lens, and then we went through the process of fitting the individual with the Ovitz higher order aberration correcting lens, and these were the results. You can see that the bar graphs have reduced, the maps are more homogeneous, things look overall improved. This corresponded with an improvement of visual acuity of about 2 lines. The individual went from being 20/40 to being 20/25. The individual also experienced a reduction in the higher order aberrations of about 40% and reported that the visual acuity was improved significantly at nighttime. Our second case was a case of mild keratoconus again. This individual had worn a standard scleral lens with vision of 20/30. When we went ahead and did the Ovitz lens, you can see the Ovitz lens is in blue, the original scleral lens is in red. You can see that we improved the higher order aberrations dramatically in this individual, and that corresponded with about 1.5 lines of visual improvement, going from 20/30 to about 20/25 plus, meaning that they got a couple of the letters on the 20/20 line. Our next one was a moderate keratoconus. This individual was actually doing quite well with a standard lens at 20/25 vision. We went ahead and fit them with the Ovitz lens, and you can see here that we had a reduction in the higher order aberrations by about 45%. And that corresponded with a line of visual improvement going from 20/25 to 20/20. When we looked at this case, this was our next one, case 4, a severe keratoconic individual who had 20/30 vision with their standard scleral lenses. And we can see that we reduced their higher order aberrations quite a bit here, about a 40% reduction in higher order aberrations, and that corresponded with an improvement in visual acuity of about 1.5 lines, going from 20/30 to 20/25 plus, again meaning that they were able to get a couple letters on the 20/20. Our last case here is an extreme case of keratoconus that was status post intact. So you can see that this individual has an extreme level of keratoconus. With a standard lens, they were only able to achieve vision of 20/70. However, with the higher order aberration correcting lens and the reduction of higher order aberrations of about 47%, we were able to provide this individual 5 lines of visual improvement, going from 20/70 down to 20/25. Overall, our summary of the initial cases that we've done has resulted in visual improvement of about 2 lines of visual acuity, ranging from anywhere from 1 line up to 5 lines. And our higher order aberrations have been reduced on average about 50%, with a minimum improvement of about 40% and a maximum improvement of about 62%. Since these initial cases were presented here, all of those being cases of keratoconus, but we have also used these lenses on individuals who have undergone RK surgery, have had post-LASIK or corneal ectasia, corneal transplants, and just other forms of irregular corneas, and all of them have had similar results. We're currently undergoing a prospective clinical trial here at the Cornea and Laser Eye Institute. If you have any questions, you can email us here or visit our website here. Thank you so much for the time, and take care.